This is part one of the patient information leaflet describing the study titled Maximising Equity and Accessibility of Acute Stroke Care Pathways in Ireland, a survey to understand patient outcomes and experience. Part 1 describing the study. Why is the study being done? The Health Research Board is funding research which examines the experience of patients who have had a stroke recently. We wish to understand how best to organise and plan stroke services to meet the individual needs of people who have a stroke. We're interested in the whole patient journey from the moment the stroke symptoms started until a person gets home again. In this study, we're especially interested in the early or acute phase of stroke. By speaking with people who have recently had a stroke, we might see patterns in their stories that could help us identify areas for improvement in care and services. And we want to make every patient's stroke journey better and reduce any potential after effects that a person might have after a stroke. Your experiences are very valuable to us. We believe that hearing your story will help us to improve care for other people who have a stroke in future. So who is organising and funding the study? The study is being organised by a team of researchers who work at Beaumont Hospital and in the Royal College of Surgeons in Ireland. The study is funded by a grant from the Health Research Board, or HRB, and is part of a postgraduate qualification, or PhD, for a doctor who works in stroke care in Ireland. Why am I being asked to take part? We are asking you to consider taking part because you have recent experience of having a stroke, and so we feel we can learn from your experience. We believe that understanding your individual stroke journey can help us improve how stroke care is organised for everyone who has a stroke in future. How will the study be carried out? People like yourself who have recently been admitted to Beaumont Hospital with a stroke will be made aware of the research study by a doctor and their clinical team. If you're interested in learning more about the study, then a member of the research team will explain the study to you in detail. There are two parts to the research. Firstly, everyone who participates will be asked to complete a survey with the researcher while you're at the hospital. The second part is 3 months later, where some people, though not everyone, who participated in the survey will be invited to take part in an interview about their experience. About 1 in every 5 people who complete the survey will later be invited for an interview. Then interviews will last about 40 to 60 minutes and they will be held at the place of residence of the participant at that time or online if they prefer. Initially, you'll be given time to think about if you're interested in participating in a survey containing questions related to your stroke. We'll also ask if you would consider being contacted again in about 3 months after your stroke to discuss if you would like to participate in a follow-up interview and your experience about the time of your stroke and your experience afterwards. The researcher will return usually the next day after you've had time to think about it and you've read this information leaflet, and the researcher can answer any questions that you may have about the study. If you agree to participate, you'll be asked to sign a consent form to give your permission to participate in the survey. You will also be asked if you consent to be contacted again in 3 months' time and your preferred means of contact, for example, telephone or email. And if you do not want to be contacted for a follow-up interview, that will not affect your care in any way. If after 3 months you are contacted again, you may decide you don't want to take part in an interview, and that will also not affect your care in any way. You're under no obligation to participate in any research study. If you do choose to consent to participate in the survey, the researcher will fill in the survey with you. Participating in the survey puts you under no obligation to take part in a later interview should you be invited to do so. What will happen to me if I agree to take part? If you agree to take part in the study, the researcher will go through each of the questions of the survey with you one by one. The survey will have questions about stroke in general, but also about what happened to you personally from the moment you noticed stroke-like symptoms, your experience of getting help, of getting to the hospital, and your treatment. The researcher will fill in the answers with you on a secure tablet device, and you can check that the responses reflect your experience accurately. If you cannot remember details from the time of your stroke, don't worry, that's common. But it's still worth completing as many of the survey questions as possible. The survey will take about 20 to 30 minutes and will be filled in at a time that suits you and will not interrupt your time with your multidisciplinary team members. Your care will always be a priority. The researcher will also review your medical records on the ward to collect information about your stroke, including the type of stroke, your blood pressure and blood sugar readings at the time of your stroke, your medical history, and you will not be asked to give blood samples or have any new tests. If you attend to Beaumont Hospital by ambulance, we'll also ask the Dublin Fire Brigade to summarise the times that they recorded for all calls related to your stroke. You can stop participating in the research at any time For example, you may experience tiredness and need to rest or be called away for therapy or a test. And the discussion when completing the survey will not be recorded in audio or video format. If recalling or describing the details of your stroke cause you any distress or upset, you can tell the researcher you wish to stop answering the surveys at any time. You can stop for a break temporarily, or you can withdraw from the study altogether, and this will not impact your medical care. Your distress will be acknowledged and supported. What are the benefits? Time is very important in stroke care, and we want everyone to get to hospital as quickly as possible if they think they might be having a stroke. While you may not benefit directly, it is hoped that the results of this study will help people who have a stroke in future to have the fastest possible access to the care that they need. We want to improve how stroke services are planned and organised to make them as fast and efficient as possible for everyone, so that people have the best possible outcome after their stroke. So what are the risks? This study involves a survey with questions about your recent experience of stroke and about your understanding of stroke in general and general stroke care and of stroke services. It will ask what happened around the time when you first noticed symptoms of stroke. For some people, this might be distressing to recall. So if you experience any distress during or after discussing the questions on the survey, you can speak about this to your research team or to your medical team. Additionally, the Irish Heart Foundation have a stroke support group who can be contacted by telephone on 016685001 Monday to Friday, 9 a.m. to 1 p.m. And they can also be contacted by email using the address support@irishheart.ie. Confidentiality is important in research studies, and we have a number of safeguards in place to ensure that all our conversations are confidential. In a hospital, this can be a challenge. All the files and paperwork for the study will be confidential, and every effort will be made to make sure confidentiality is maintained at all times, while also giving everyone who wishes to participate the opportunity to do so. What if something goes wrong when I'm taking part in the study? It's very unlikely that anything will go wrong as a result of participating in the study. However, if you feel distressed as a result of the survey, you can speak to the researcher or to your stroke team. And this form has contact details of the research team on page 1, 7 and 9, whom you can contact for advice or support. Is the study confidential? All information collected will remain confidential at all times. Your personal details, such as your name, your date of birth and address, and your contact details, such as your telephone number and your email address, will be coded so that only the research team will be able to determine your identity. We will let your GP know if you participate, unless you prefer that your GP is not made aware. If, however, your answers to the survey questions indicate that you're very distressed, then your medical team will be told so that they can support you appropriately. Your medical records will remain in the possession of Beaumont Hospital at all times and never removed from the hospital for this study. You have the right to access all information gathered with regard to your contribution to the study, and we hope to publish the results of the study in scientific journals. However, you will not be identifiable in any publication. We will anonymously acknowledge your help in this study in future publications.